The venue selected for the Universal Health Coverage meeting is Oman. So what better opportunity than to have with us His Excellency Minister Ahmed Mohammed Abid Al Saadi. Welcome.
Thank you very much.
Why Oman was selected was obviously because you have a good program for universal health coverage.
Well, to start with, I'm delighted that Oman was chosen for this extremely important meeting. And I'm grateful to my colleagues in WHO, whether the regional office in Cairo or the headquarters, for giving us this opportunity to host this important meeting. Oman's achievement in healthcare over the last 48 years are remarkable, true, but there is still a lot to do. And universal health coverage is very important topic to everybody. And as it was mentioned in several of the talks, we need the political commitment for universal health coverage, and Oman stating this now and before that there is at the highest level political commitment for healthcare and for universal health coverage.
For other countries to follow suit, when we say political commitment, at what level of political commitment? The top leadership, the Prime Ministry, the Ministry of Health itself, where do we need this political commitment?
Since His Majesty Sultan Qaboos came to the throne in 1970, he put health and education at the highest level in his agenda.
Great.
So it has to be number one, because without health, there'll be no development. Without health, our children will not achieve schooling. Without health, the economy of the country will not be sustainable.
My question is, you said there are still some challenges. You've achieved a lot. What percentage of population approximately is covered for healthcare?
The secret of Oman achieving almost universal healthcare coverage is the primary healthcare, which is well established in Oman, and we are covering more than 95% of the need of the public by primary health care.
And the primary health care covers both preventive and curative?
Absolutely. Health promotion, health education, diagnostic and treatment. In addition to, we are introducing more tasks to primary health care like rehabilitation and even palliative care. We are integrating a lot of our services into the primary health care, which is affordable, accessible, and equitable.
Another challenge which Oman may be facing is that you have a lot of expatriates who are living here. Are they part of the healthcare system, or how are they reached?
We believe in Oman of equity and equality. Equity, whoever lives in Oman, whether an Omani or non-Omani, they deserve the best healthcare available.
That is something so wonderful to hear.
And I think we are in the process of making it even better by introducing, hopefully, a form of health insurance which will cover our colleagues, the expatriates, so we rely on them to help us in building our country.
Sure.
So in Oman, we, alhamdulillah, as they say in Arabic, thank God, there is no discrimination, no differentiation.
Wonderful to hear.
We are all human and we should behave as such.
I don't know, Dr. Saadi, I don't know what to say except that we have been, engulfed by your hospitality here in Oman. It's been wonderful for us as WHO to all of us hold the meeting here, and we hope success for this meeting, that all the other countries as well can follow suit. We heard the Turkey experience and we have the Oman experience. So there are countries that are struggling, especially with population problems and stuff like that. But I'm sure that together with the political commitment,
we are learning from each other, we will be helping each other, and whatever experience been successful in any country in the region, it should be shared and we should all learn from it. Oman is more than happy and willing to pass any experiences that our brothers, colleagues, neighbors think they are appropriate for their system, and we'll be more than happy to share it with them.
Thank you very much. Thank you, my pleasure.
Thank you.